One of the things in the College of Nursing and Health Sciences, we have health professions program. Our largest, of course, is nursing. But we also have social work, which has a big presence over in Rochester and throughout the region. We also have the athletic training, along with that exercise and movement science, cardiopulmonary rehabilitation, and we have recreation and therapeutic recreation. All our graduates, many of them end up in Rochester or in this area. I mean, I know of no other place that has the quality of health care, going all the way from western Wisconsin to Mankato to northern Iowa, up to the Twin Cities. It has better health care environment than we do here. And that attracts students that want health care. They want to come to this environment to learn, and many of them also want to stay here and practice, whether, again, it's nursing or social work or cardiopulmonary rehabilitation.
When I was going to WSU for my undergrad, I was really inspired the way the program was set up. I felt like I got all the foundations for nursing, the nursing basics and the public health education. I felt like the professors were very supportive, very engaging, continued to push me, to inspire me, that not only would I be able to get my nurse practitioner certificate, but also I could come back and get my DNP, which is the actual practice of nursing.
We all love nursing, and passing that on to our students every day is a joy, really.
I got the family nurse practitioner and ended up getting a job at Minneapolis, where I currently live right now. I work at a community clinic. We work with a lot of underserved patients and families, and that's what I love about nursing, that you could work different communities and do all sort of great stuff and have impact.
We have a program with Winona Health, and it was taking students who are in our health coaching minor program and pairing them up with persons who are at risk of being re-hospitalized or going to the emergency room. And they work alongside social workers and nurses from Winona Health for these persons that have been identified of having health problems. And the health coaches go in and talk to the individuals and work with them on health behaviors. I saw one of the students and the person they were working with walking around East Lake, for example. But when you ask those students who are in that, how's it going? They just beam. I mean, they just glow. And so how do we make the community a better place? I think we're instilling the value and the benefit not only to the person you're serving, but to yourself when you give of yourself in that way. And so I think that's probably one of the things I'm most proud of in terms of the college and the university is how we teach the value of service to others.
The most important changes, I think, that have occurred in Rochester and continue to occur in Rochester are related for us to healthcare and the needs of patients and families who come here, who are served not only here in Rochester, but throughout the region. We serve a lot of students from the southeastern part of the state, as well as Minneapolis-St. Paul area and other places in our region. In fact, one of the innovations that we are most recently implementing is the Psych Mental Health Nurse Practitioner Program, which is a graduate certificate program, which is primarily online. So our students are in Duluth, and they are in many rural places throughout Minnesota, as well as in the Rochester area.
We've been approached about the very severe need for more health professionals in the area of mental health services. And I don't think anybody that's turned on a television lately is not aware of what's happening with the need for mental health services. In response to that need, and again, that came not only from the wider community, but also from the practice community, we developed a track in our graduate program for mental health nurse practitioner. We have a very healthy graduate program. We did not need another program, but the community very much needed those professionals out in practice. And so we worked with all our clinical partners. We also worked with La Crosse area and Viterbo University and the community down there, so that because this was a bigger problem than just Winona State, and we developed the Psych Mental Health Nurse Practitioner track. And without any advertising, we've had a good cohort of students that started last summer.
I think what makes us unique in this area is that we have the opportunity to listen to a lot of our communities of interest. Our faculty are very involved nationally and internationally as well, but always listening for kind of the implications for the Rochester community. And so the Psych Mental Health Nurse Practitioner Program is an example of a program that responded to a need for innovation, for creating a program that met the needs of students where they were living and working. I think as broad as the needs are in Rochester, there are depthful needs too that we as a program can meet because we have nursing faculty who serve on a variety of committees. They're involved in their communities, whether it be here or in other smaller communities around the southeastern Minnesota area. And we know the needs because we're part of the citizenry. We deeply engage with our communities. And so we do know those needs. And I think that gives us an opportunity to serve in the way that I think we're called to serve.
We're traditionally a face-to-face program. We're a regional university. Students have a lot of options out there for online education. But we also got approached by RCTC, their Health Professions College. We got approached by various healthcare institutions that they had workers and professionals that were in areas like radiography and other areas that are traditionally called allied health areas who had associate's degree but wanted bachelor's degree. And those persons were dispersed over a wide geographic area. So we developed one of the first online majors, completely online majors for Winona State University.
I think that our opportunity as faculty is that we listen to our students and we get to know them really well. Repeatedly on surveys of our graduates and our current students, what matters to them is their good relationships with their faculty.
All the faculty of the nursing department are really great. They're very friendly. They're very approachable. I feel like Rochester is very diverse. For someone like me, even the school itself is extremely diversity, so I really like that about it.
I think Rochester is a rich community because of the diversity of immigrants and refugees who have come to be with us. We, as Winona State, Rochester, have been part of Rochester Healthy Community Partnership for quite a while, since 2004. And that group's involved deeply within the community in health initiatives, health promotion initiatives for those who are underserved.
When you talk about inclusive diversity and inclusiveness, I think Winona State leads by example first and foremost. I think that approach carries out into the community that surrounds us in terms of how should we help with inclusion and diversity. And so just by the fact that students are working alongside, are learning alongside a diverse group of students that come from very different backgrounds, that's what adds richness to the university, but it also enhances, that carries forward, that carries out into the communities we serve. And so I think when you look at why would someone come to Winona State, that welcoming attitude, that welcoming, the way we conduct ourselves is very apparent. And who wouldn't want to come to some place where you're welcomed?